Before we get started, I would like to give a big shout out to our sponsors for making the event possible. Thank you very much. And then without further ado, I will hand the microphone off to, we have Jarrod and Mitchell today speaking with us. And Jarrod, if you're ready, the floor is yours.
All right. Well, hello, everybody. Thank you guys for hopping on with us over the next 20 minutes to learn about the CHAMP plan. Not only does this have a very cool name to it, but it's also filled with many financial and healthcare benefits for employees and employers. My name is Jarrod Ferstl. I am the proud founder of Better Employee Benefits. Better Employee Benefits was founded with the hopes to become the most socially responsible insurance brokerage in Colorado, while providing quality and innovative benefits to companies across the state. When I started this company, I saw a huge lack in private funding going to local nonprofits. And I am now dedicated to increasing the funding available for nonprofits local to my clients. And because of that, I donate a minimum of 50% of my profits to community foundations dedicated to serving their local communities. Better Employee Benefits is a full-service employee benefits brokerage with strategic partners, and I'm going to introduce one today. Today, I'm introducing Mitchell Fink. He is the Regional Vice President of AffordaCare Insurance and the product knowledge expert on the CHAMP plan. Mitchell is going to walk you through the great benefits of the CHAMP plan, how it works, and how easy it is for companies to get started. Mitchell, the floor is yours.
Thank you, Jarrod, for that introduction. This is my first attendance to the Good Business Colorado Association. So I just want to say thank you for allowing me to be part of this. It seems like you guys are a really great group of people, my kind of people. And as Jarrod mentioned, there's a lot of things going on in the insurance world. We all know that it's expensive. Businesses are trying to stay afloat by offering great benefits, better pay, etc. So what's exciting, and before I get started with my presentation, I want to give you a little background quick about myself and how I met Jarrod. I'm the vice president of a company called AffordaCare Insurance. So we're based out of Dallas, Texas. We've got 53 offices across the United States, 11,000 agents. We work with businesses just with their benefits. That's what we specialize in doing. And been in the insurance world for about 16 years. The product that I'm going to show you guys today is by far the most unique product that I've ever seen on the market. And here's why. We all know most of the time when you introduce an insurance product to a business, it's going to cost that business owner something, right? And that's the last thing this day and age that a business wants to hear, something that's going to cost them more money. This product you're going to get to see here in the slideshow is such a unique product because it's completely funded by tax savings, and it is going to increase employees' paychecks. It's going to provide free medical coverage, and it's also going to provide the business owner some substantial payroll tax savings. So we've just addressed three of the top concerns a business has: saving money, giving the employees better benefits, and giving them better pay. So that's why Jarrod and I have teamed up together. Jarrod's got an insurance brokerage. I've got a brokerage. We teamed up together today just to more or less educate you guys on this product is available. We all know business owners that want to give better pay. We all know business owners that want to give better benefits. And we know business owners that want to save money. And that essentially is what this plan is going to do. So I'm really excited to just be able to educate you on this plan, let you know what it does. Now, we're going to dive a little bit into the weeds here. There might be some terminology that you just don't understand. We can answer any questions along the way. But like I said, mainly we just wanted to get this in front of you folks, let you know that a product like this does exist. In 16 years of selling insurance, this is by far the coolest, most unique product that I've ever come across. So with that being said, I'm just going to start my presentation. Once again, thank you guys so much for just having me on here. I'm excited to get down into business here and show you guys the product. So the plan is called the CHAMP plan. Now, essentially, what the CHAMP plan is labeled as is a health management plan. So what it is designed to do is to give employees a track to run on to become a healthier employee. Okay. Now, I'm sure everybody wants to achieve something with their health, right? Maybe they just don't know the proper steps to take to achieve that. Well, what's great is when we introduce the Champ Plan to a business, we ask each employee, what do you want to change about your health? And we get a plethora of different answers. They want to quit smoking, they want to lose weight, sleep better, control anxiety, depression. We get a plethora of different answers. But whatever that employee says they want to change about their health, we put together a digital virtual treatment program for that employee to achieve that. And they access it through an app on their phone. Now, here's what's cool. Not only does this program encourage and show people how to become healthier, like I said, it increases employees' paychecks, saves the business owner tax dollars, and it gives free medical coverage. So you're going to get to see all these things next. But at the end of the day, this plan has been around, guys, for 10 years. We've had extreme good success with it. Some of the companies, in fact, that we work with are some of the largest companies on the planet have this now through our brokerage, through Jarrod, myself, etc. Companies like Amazon, Domino's, Dunkin' Donuts, Popeyes, Denny's, some of the largest franchises on the planet now have this plan. We also work with some of the largest payroll companies on the planet right now. ADP. If you're not familiar with what a payroll company is, these guys just kind of help assist in the payroll for a business. ADP is the number one payroll company. Paychex is number two. iSolved is number three. They all fully endorse this plan now, and they're going to be introducing it to all of the businesses that they do payroll for. So that's why we wanted to give everybody on this call the opportunity just to take a look at what a lot of companies are getting involved in with the Champ Plan. Now, let's talk about what this plan does and really how it can impact the business. Because as I mentioned, we all know somebody that has a business that could potentially use this. Now, what's cool about this is, and before I get started, I always like to let folks know what Section 125 is. Now, as I mentioned to you guys, there's going to be some terminology on here that you just might not understand. Well, I'll do my best to explain what these terminologies mean, okay? So Section 125 is simply just a section of a company's payroll that allows them to run the cost of an employee benefit through their payroll on a pre-tax basis, okay? So this plan, when a company takes it out, it runs through their payroll on a pre-tax basis. So it creates a pre-tax benefit. Now, as I mentioned to you, this plan is a health management program. It teaches people how to become healthier, and it's really good. I love the way that this works because you get to digitally access a treatment program just through an app on your phone. Now, what this plan also does is it provides free medical coverage. You heard me right. It's free medical coverage. But what's really great about it is the medical coverage the plan does provide, it doesn't interfere with any other medical coverage that a company may have. In fact, these additional benefits that this plan provides actually enhance a company's current benefits. And you'll get to see how that works in a second. Now, what I love about this plan is it gives a proactive approach about healthcare. Guys, there's no secret. We live in a reactive society. We all think we're 10 foot tall and bulletproof until we get sick. Then we head to the doctor, right? Okay. Now, this plan kind of flips that on its lid. We can give you a proactive approach to healthcare using our predictive modeling platform. So this app is so amazing because what happens is each employee downloads an app and they're required to watch a video. About 5 minutes is all it takes, one time a month. And that video is going to be in regards to what they want to achieve with their health. So if Jarrod wants to lose weight, this video is going to teach him how to lose weight. But it also asks you a couple questions about yourself during or after that video. And this app and this program stores that data from the questions, and it can actually predict health conditions before they happen. We've stopped people from becoming diabetic. We've stopped people from having hypertension by using our program. So it gives you a proactive approach to healthcare, which is really good. Anytime you can prevent a health condition from happening, I think everyone on this call would agree it's a good thing. But these last two bullet points are really kind of our bread and butter to this plan. One thing that is so exciting about this plan is it creates a guaranteed tax savings of $573.60 per employee per year. So that's great. That's exact tax savings numbers. I just enrolled a company of 100 employees. That business saved $57,360 just by having this plan in place. So there's where we save business owners money. We save them payroll taxes. Now we're going to talk about how we do that in a second here. But I'm giving you a 30,000-foot view of why this plan is so attractive to business owners. The fourth bullet point is what this does for the employee. This plan, if an employee wants to participate in this plan, they are going to actually get an increase in their take-home pay. We see about $125 per month net pay increase per employee, about $1,500 a year. Why this plan is so exciting is because this is a plan that a business owner can introduce to their employees and give their employees a raise, and it's not even coming out of their pocket. So not only is the business owner going to save tax dollars, they're going to give their employees a raise by using this plan. Now, we're going to talk about how we do that here in a second. But all of these are the great, strong features of the CHAMP plan. Now, let's talk about the benefits. As I mentioned to you, a free medical plan comes along with the CHAMP plan. The very, very first benefit is we give zero copays for primary care doctor visits and urgent care visits. So every employee that enrolls in this can go to see a primary care doctor or go see an urgent care facility, and it doesn't cost them a dime to do it. Okay? So that's a free medical benefit. And here's what's really exciting. We use the First Health Network, which means these benefits, guys, are accepted basically everywhere. Okay? So if you got a favorite doctor that you use, there's a good chance they'll have these benefits accepted. The next benefit is preventative services. We all want to go have a checkup or a physical, or, there's a lot of folks that have colonoscopies, etc. Any preventative care that you would like to get done is going to cost you nothing for that employee. There's 18 services that we are going to provide to the employee for free. Okay. Now, unlimited prescriptions. Here's another great benefit. We have 432 medications that we can now offer an employee and their family members, and it won't cost them any more than $1. I mean, that's phenomenal, guys. Think of somebody that routinely takes medications and it costs them $10 a prescription. We're saving employees money. Okay. Another thing is virtual direct primary care. This is another benefit, guys, that comes with this plan for free. Okay. Virtual direct primary care is one of the greatest things ever. It's like having your own doctor in your home. Instead of having to go to a facility and get diagnosed by a doctor, sit in a waiting room, have them take your weight, your blood pressure, all that fun stuff we love to do, you can literally have a doctor diagnose you virtually with lots of illnesses using virtual direct primary care. Give you a quick idea. I had a son who had strep throat. I knew he had strep throat. He had white spots on the back of his throat, a dry cough, he spiked a fever. We all know as parents that's strep throat. I got on the virtual direct primary care. I got on the call with the doctor. I said, he's got white spots on his throat, spiked a fever, dry cough. He said, we'll have penicillin waiting for you in the morning when the pharmacy opens. I never stepped foot in that doctor's office. So I saved myself time and I saved myself money. And that's what this CHAMP plan does for employees. Saves time, saves money. The next thing here is one of my most favorite benefits on the planet. There's no secret that there's a mental health crisis going on. There's bullying. There's all sorts of things going on in this world right now. Well, I don't know if you folks are aware of this, but there's a 3-month wait to see a therapist right now across the United States, which is really, really tough when you've got a problem that you need someone to help you with. Okay. Now, what's great is rather than employees having to wait 3 months to talk to somebody about addiction, maybe a divorce, maybe depression, anxiety, rather than waiting 3 months, which might be 3 months too long, now they can virtually access a therapist right then and there through Champion Health. And they can have unlimited visits for them and their family members next day. And it's free. It doesn't cost a penny to have it. So that's just another wonderful benefit that we can now offer businesses. And it's not going to cost them anything. I'm going to show you how this plan is paid for. Now, Here's a breakdown of some of the other illnesses and behaviors that we treat using our benefits. You can see here, pretty robust plan. Covers all of these illnesses that go along with the virtual direct primary care. These are some of the illnesses that can be treated by seeing a therapist through our virtual treatment with therapy sessions. The next thing I want to show you is the app. Now, as I mentioned to you guys, this plan has predictive modeling. What I love about this plan, we can predict things before they happen. And here's how it works. An employee enrolls in this plan, and we ask them what they want to change with their health. They're required to hit a button and watch a 5 to 7 minute video about what they want to change with their health. So if Jarrod said, I want to sleep better, that video that employee watches is going to teach them how to sleep better. Maybe what you should or shouldn't eat before you go to bed. It'll teach you things, but then it's going to also ask you questions about your health, and it compiles that data and it tells you, hey, you're at a medium risk for depression. So if you want to correct that, you click on the depression tab and you get to watch a video about how you can correct depression before it happens. So what's cool is we want you guys to all have a low risk of health conditions. Healthy employees show up to work. They don't end up in the hospital. They don't have to spend too much on healthcare. That's the idea behind having predictive modeling. So super cool how this thing can predict health conditions before they happen. Okay, now I do see we have some things in the chat box here. So I'm going to answer a couple of questions and we'll keep going. Jervis said, how many employees are required to be eligible for the plan? Awesome question. 5 employees. So as long as you have 5 employees, we can implement this into your company. And it says, do you schedule PC visits through the app? Absolutely. You can schedule all your services right through the app, which is really, really cool. It's called the Health Wallet, actually. So great question. Thank you for the questions. Keep them coming. If you guys have any questions, love to answer those for you. So next thing here I want to talk to you about is artificial intelligence. We start seeing that a lot now. AI is becoming a really big thing. We actually have artificial intelligence built into the app that literally you can scan your face and it can tell you all of these health metrics, your skin age, your heart rate, and it's eerily accurate. I compared this data with my smartwatch and it was identical. Now, how it does it, that's for the experts. I just know how it works. So, but it is really cool that you can track certain health metrics right by scanning your face through this program. Another great tool to keep people healthy. 2 more slides and we're done here. What the employee is required to do is download an app, 1 video per month about becoming healthier, and then take a short quiz. It takes 7 minutes a month. By doing that, that employee is going to get paid an insurance claim that will increase their paycheck. So you get paid to become a healthier employee. How cool is that? Not only are you going to become healthier, you're going to get paid for it. Once you complete that video, you get an explanation of benefits. Shows, hey, you just got paid for becoming healthier. Okay? Now that insurance claim payment is going to show up on their paycheck. This is the last slide. Now this gets a little bit into the weeds a little bit, guys, but I did want to show you this slide because it does show you how we increase an employee's paycheck and how we save businesses tax dollars. Okay? So that's really why I wanted to show you this. So the paycheck on the left over here is a paycheck that we're all familiar with, right? It shows their gross pay and then all their taxes come out. So there's over $1,000 of taxes that comes out of this person's paycheck. So at the end of the day, that person takes home $3,900 even though they made $5,000. Doesn't seem real fair, but that's the world we live in, okay? Now, there's a paycheck on the right side. Now, this paycheck is an exact example of what someone's paycheck looks like who has the CHAMP plan. So as you can see here, there's their monthly pay, but we're going to move $1,200 of their monthly pay as a pre-tax deduction. Now, we don't take that money and we don't send it anywhere. We just move it. So we're going to move that $1,200 down here under the qualified deductions section of the payroll. That $1,200 is going to be used for 2 reasons. It's going to be used to pay the insurance claim for watching that video, and it's going to be used to pay for those medical benefits that we just went over. But here's what's so cool. Because that $1,200 is being used for those two items, the owner of the business doesn't have to pay Social Security and Medicare tax on that $1,200. So up in the right-hand corner, you'll see the business owner saves $91.80 a month in taxes per employee. Now, what's great is the cost of this program for that business owner is $44 a month per employee. But guess where we're going to take the cost of the plan out of? We're going to take it out of the tax savings we gave him. So the tax savings we gave this business owner pays for the plan. So it's not even going to cost him anything to have this plan. It leaves the business owner $47.80 per employee per month of tax savings. $47.80 times 12, that's $573. Guys, remember how I told you in the beginning, for every employee that signs up, the business owner is going to save $573 in taxes per employee per year. So a company of 1,000 employees saves $573,000 in taxes just by having this plan. Now, here's what else is great, and I'm just about done. I know I'm getting to the end of my time here, but at the end of the day, instead of getting taxed on $5,000 because we moved $1,200 down here, this employee is only taxed on $3,800. We saved that person $326 in taxes that he would have paid to the government. Once that employee watches that video, they get an insurance claim payment of $1,010, which increases the employee's paycheck. This employee is going to make $135 more a month for watching a 7-minute video about being healthier. And they get all of those additional medical benefits for free. So guys, that is the end of my presentation. I really kind of rushed through it. There's a lot of moving parts to this, but we wanted to let you know that there's a program out here. We did attach our flyer in the documents section of the app, I believe, Blake, I think it is. So if you want more information, our contact information is there. I believe Jarrod threw his contact info in there. But at the end of the day, I do want to say this plan saves businesses tax dollars, increases their employees' paychecks, and gives free medical coverage. Those are the three concerns that business owners have right now, and we can address those concerns with the CHAMP plan. So I just want to say thanks again, though, everybody, for having us on here. It's been my pleasure. I did see there's some questions. Blake, do I have time to answer those questions?
You sure do, yeah. If you want to go ahead and address those, go for it.
Okay, perfect. Stacy said, who is the TPA and how many members are in your our third-party administrator? So we have our own in-house third-party administrator that does help with the enrollment on this plan. And as far as members in your TPA, I would assume you're wondering how many members work for our TPA. And I would have to, I know there's a staff of about 10 in that TPA, but the third-party administrator is only involved in setting up the payroll for the company. So the next question, very good question. What is the impact on the Social Security benefit for the employee? Awesome question. This is one of the biggest concerns, not even a concern, a question that comes up is being that we're lowering taxes, right, guys? That means they pay less into Social Security. So we've created illustrations to see what the impact would be. The impact is very minimal on the Social Security, but here's what's great. The increase in pay is more than what the Social Security impact is. So it's actually more beneficial to have this plan in place and give yourself a pay raise up front that you get now versus the impact that you'll get when you collect Social Security. So awesome question, by the way.
I believe Stacy had a follow-up.
All right. How many groups? How many groups and employees members? Are you speaking in regards to how many groups and employees members we have on this plan, Stacy? Because the third-party administrator that we speak of is only involved in setting up the payroll process for the enrollment. How many are in the TPA? Like I mentioned, the third-party administrator, we are not the payroll provider. Every company has their own payroll provider. We simply have our own TPA called Concierge Benefit Services. They have around 10 employees that assist us with the enrollment. And all that TPA does is set up these two line items in the payroll. It says how many groups and members in the champ plan total. We right now are knocking on the back door of over 500,000 lives involved in the champ plan, just in our brokerage alone. Do we have a tax opinion or an IRS letter? Yes, absolutely. We do have a tax opinion letter. IRS opinion letters, those are called private ruling letters. And those IRS letters, we've attempted to actually get an IRS opinion letter, but they do not actually give Section 125 private opinion letters. But we do have tax opinion letters, and we would love to share them with you. It says, are we pitching a product during this conference? Unfortunately, guys, I'm out of Iowa, but Jarrod, I'm not sure if he'll be showing up there or not, but unfortunately, I'm just here for the virtual side of this conference. But we would love to do presentations at your leisure any other time after the conference.
Well, thank you so much, Jarrod and Mitchell. Appreciate you guys for your time. Super fascinating.
Excellent.
And one last thank you to our sponsors for making it happen. And I hope everybody has a great rest of the day.
Absolutely. Thank you.